Are you struggling to support someone with their oral care routine? Maintaining regular oral care is an important part of living well at home. However, it can be really challenging, especially if someone's resistant to opening their mouth. This is often the case when someone is experiencing cognitive or behavioural changes, such as in dementia or brain injury. The first thing to do is identify the probable cause. There may be pain or discomfort in the mouth, which could make oral care unpleasant for the person you're caring for and more difficult for you. You must be extra careful when supporting someone who has difficulty communicating, as they may not be able to let you know that they're in pain or discomfort. When facing these challenges, it's tempting to rush oral care, but with the right techniques and setup, you can make the process easier and reduce anxiety for the person. So when you're supporting someone with mouth care, it's really important to consider the setup so that the experience is as comfortable for you and the person you're supporting as possible. It's preferable that you support someone from a sort of side angle so that you've got as much room to move around as possible, but also it feels less confronting than being head-on when you're providing support. So this is particularly important for those living with dementia who may be experiencing changes to their peripheral vision or spatial awareness. So communication is really important when providing oral care for someone, as this builds trust and it creates an anxiety-free environment. It's also useful for reassurance, particularly if someone struggles with regular oral care. If someone's non-verbal, it's still important to explain everything you're doing, and this isn't just before you start the process, but also throughout, explaining every step of the way so that they feel reassured throughout the process. So I'll give you an example. Norman, we're getting ready for the day now. Is it okay if we start by brushing your teeth?
Yes.
So it's really important to create a calm and relaxed environment for mouth care, but also giving yourself enough time for the whole process. Some people may benefit from a really quiet environment, which is distraction-free, but actually distractions can be useful for some people, such as having quiet music on or having the television on. So allowing enough time for oral care can also give the opportunity to notice changes in the mouth that may otherwise be missed if you're rushing. Things like oral infections, dry mouth, or other concerning signs. So it's a really good opportunity to give the mouth a good check. So you don't have to do everything in one go. Some individuals have very small windows where they're agreeable to mouth care or it feels comfortable enough. And so you might like to do the most important parts first, potentially return later, or even return another day, even if it just means cleaning one side of the mouth and then remembering the side that you've cleaned for the next time, or just cleaning the front of the mouth first. So some people may benefit from having a really specific routine around mouth care so that they're being supported with it at the same time every day, so they can predict when it's happening, it can make them feel more comfortable. Whereas for other people, it may be more about finding those perfect spots throughout the day where they may be more agreeable to mouth care. It might be dependent on fatigue or mood, and that's okay. It's better than not completing it at all, and it doesn't necessarily have to be completed at those traditional times, such as in the morning and the evening. So modelling to the person you're supporting can really help them to understand what you want them to do during mouth care. It can also be reassuring and can build trust and independence. So Norman, if I give you that. Okay, Norman, we're going to brush our teeth. We're going to start with our right side, okay? And then we're going to do our left side. So it's really important to encourage independence when supporting someone with oral care. And there are lots of techniques that you can use before actually directly brushing someone's teeth for them. And one technique is, if I demonstrate on Norman, if you hold the toothbrush for me, I'm placing it in his hand and I'm bringing the brush gently to his mouth. I'm sort of starting the process for him and signalling the action that he needs to be doing, but then I'm letting go and allowing him to be independent for the rest of the brushing. So another useful technique is called hand-over-hand support. If the individual is able to hold the toothbrush independently, but they might just need a little bit more support and guidance with the actual brushing motion. So Norman's holding his brush, and I'm just gently guiding it to his mouth, and I'm just supporting him with that process. It's useful for people who may have reduced strength in their limbs or coordination issues. So another technique you may like to use is called hand-underhand support, which is useful for when the individual you're supporting is struggling to hold the toothbrush themselves independently. And in this case, you can hold the toothbrush yourself and then gently get the person you're supporting to hold their hand over yours. And we're just going to go in brushing your teeth. So they're still getting that motion of toothbrushing and it's still encouraging some degree of independence. Biting or clamping down with the teeth during oral care can be common, particularly for those who are experiencing changes to their behaviour or cognition. It can also happen if someone's particularly sensitive in their mouth, and there are some strategies that you can do to make the process more comfortable. So one thing that can help is to give a gentle massage on the cheeks, which may encourage mouth opening, and I'm going to demonstrate this on Norman. So Norman, can I just touch your cheeks gently? So this technique can also be really useful for people who bite down on the toothbrush or other tool that you're using for oral care. I'm going to demonstrate this on Norman here. Norman, is it okay if you open your mouth ready to brush your teeth? Perfect. So Norman's just clamped down on the toothbrush there. Norman, is it okay if I touch your cheek? Perfect. And then he's opened his mouth ready for me to release the toothbrush. It's really important that you don't just pull the toothbrush out when someone clamps down on it, because this can cause discomfort and may also damage the teeth. We have more videos about tools and strategies to manage oral care, which we'll link for you below. I hope you found this video useful. Be sure to reach out to your GP, dentist, or other healthcare professional if you have any concerns.